This is the Psychcast, the official podcast of MDH Psychiatry. I am the voice of MDH Podcast's Nick Andrews. And we are bringing you this special edition of the Psychcast from MDH in response to all of the unrest, peaceful or otherwise, in the United States at the shocking murder of George Floyd in late May of 2020. And Dr. Lorenzo Norris, you agreed to do this sort of after-hours conversation. I really appreciate it. We thought that, as we mentioned in the episode 119, that this would be the most appropriate response to be for us to have a real conversation about it. So welcome aboard and introduce our guest.
Very good. I'm happy to be here, Nick, and I'm so pleased to be talking here with Dr. Newsome, another psychiatrist, another young black male psychiatrist. And Dr. Newsome, sir, can you tell us a little bit about yourself and where you're coming from for our audience?
Absolutely. So, Brandon Newsome, I'm a fourth-year psychiatry resident at Boston Medical Center, so about to graduate, and about to be a first-year fellow as of July at Children's National Hospital. Was born and raised in the South, so I can talk to you about those experiences, and have been up in the Northeast for the past 4 years.
Okay. Well, Dr. Newsome, I am very, 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 very pleased to be speaking with you. I'm even more pleased that you're going to be working at Children's National Medical Center. So we're going to be close neighbors because that's Children's National's GW works closely with Children's National. But let's get right into it. A time in our country that we have not seen. A time in our country. I shouldn't say we because depending on where you were at in America, you have seen this, and you've seen this multiple times. Those of you who can't, we're talking on this Psychcast via Zoom, and I'm looking at Dr. Newsome, and he's looking at me, and he said he's a fourth-year resident, and I'm seeing a lot of myself in Dr. Newsome right now. And the question I am struggling with is that I'm still talking to you about the same stuff I was talking about when I was a fourth-year resident. I'm still talking to you about the same stuff when I was a college student. I'm still talking to you about the same stuff when I was a medical student. I'm still talking to you about the same things that were many of the precursors or push in terms of the hip-hop generation, in terms of what they were talking about earlier in regards to police brutality and violence. We are still talking about the use of lethal force and abuse of power, particularly by police or law enforcement officers, and in particular, how that is perpetrated against African-American men in particular, and the unfortunate and tragic murder of Mr. George Floyd specifically. But Dr. Newsome, I mean, how are you doing? Tell me how you're thinking about this. How are you, before we even get into like how our patients are doing or how our colleagues are, how are you doing with this?
Yeah, I must say it's been difficult. Like you, I've heard this story time and time again. I was just up on a panel with a conversation upon race and policing, and I realized in my first or second year of residency, we had the same conversation because there was another death. I will say that this, even though, like I said, all of these unfortunate deaths are really, really triggering, I'll say this one is a little bit different for me for a few reasons. One, as you know, this is in the backdrop of the COVID crisis and already seeing so many people, especially Black and brown communities, dying from that. And then like just witnessing what happened or watching that video and then thinking about like all of the interventions that we've already tried to do. So we tried to do body cameras. The dude had a body camera on. We talked about, we tried to get our police officers to be engaged and try to check their bros, right? But there were people there and nothing happened. Even to the point of having upstander. There was an upstander there, a white upstander, a firewoman who was telling them to check the pulse. Still nothing happened as it relates to that. So it's just very... I think that in the backdrop of the COVID crisis just makes it a whole lot more painful for me, and even not just me. I have a Black physician male group, and it's been triggering for all of us because you imagine that this could be me one day, especially when you think about the Amy Coopers of the world, among other things.
I agree with you completely, and I know the backdrop of the COVID-19 pandemic has just, one of the things that I'm coming to realize is that not only is there the virus and unfortunate loss of life to the virus, and may my departed grandmother, Willie Mae Newell, who lost her life to COVID-19, rest in peace. Well, thank you so much. And I bring this up. Why am I bringing this up? I mentioned it before on the MD Edge Psychcast, but under a different rationale. I bring it up because regardless of one's socioeconomic strata or title or whatnot, particularly in the Black community, this is the kind of stuff we're dealing with. We're dealing with the stress of COVID, all right, that is disproportionately affecting African Americans. We're dealing with social isolation. We're dealing with the economic, if you will, recession, if you will, collapse that everyone else is dealing with. And on top of that, we are now, as you so correctly pointed out, we are dealing with another murder in the type, not the type, but this particular murder resonates very differently because, as you said, it seemed like every single thing could have been there, including this was, I mean, you will read reports where reportedly Mr. Floyd was resisting arrest. You look at this is not a man resisting arrest. This is a man calmly in trying to say, please, you are killing me. These are other people saying the exact same thing. This is people not acting, all right? This is so many different things going on. And when you hear this, and depending on how many times you look at this video, you can come to no other conclusion other than it is murder. And for those of us, and particularly, I would say this now for psychiatrists, because the people in the audience would know this, psychiatrists, we frequently have to restrain people. All right. And it is always understood that restraint can turn into assault extremely quickly. And in this particular case, there was no thought or concern about this man's life or his health, which there are many good police officers that do think that. And so this was shocking. This was even more, it was shocking. It was jarring. It was another thing on an already, if you will, taxed Black America. And I personally, you mentioned that you were talking with your colleagues about this. I was talking with my colleagues about this in terms of other Black males. And it's interesting that you said that you were on a panel, Dr. Newsome. Mm-hmm. I think a lot of people don't actually realize at times with Black male psychiatrists, there are only so many of us. Yeah, no, true that. Yeah, there's only been so many Black male physicians, period. But Black male psychiatrists in particular, and frequently we will get called at different points in time to take leadership roles and to talk and to speak on things and to be a voice. Well, I got to tell you, after a while, this is pretty goddamn tiring or whatnot. For us to contain our disappointment, our anger, and our rage, and still stay hopeful, optimistic, and still be a voice for those who are not able to speak. So I agree so much with what you say. Please go ahead, Dr. Newsome.
Oh, I mean, I thank you. I do think that sometimes it can be tiring to have to take leadership roles and continue to talk about these things. But I also feel like, at least for me, it gives me some sort of route to address the angst and do something with it, because it's just a very unfortunate situation. I think that all of us are just dealing with how do you deal with these feelings that you shouldn't have to feel because of a murder that was televised.
Thank you. For a murder that was televised, that was tweeted, that was broadband, that was streamed. Now that we've kind of laid the framework in terms of what we're feeling, let's go to why you and I both are in this profession, and that's our patients. What are you seeing on the front, man? What are you seeing with our patients?
Absolutely. I mean, so for some individuals, like for instance, I was speaking with one of my Black male patients, and he was fearful. He had been perfectly fine, even amongst the COVID crisis, he was doing very, very well. But then, when you give this backdrop of police violence, now there's just this intense fear. Should I, be walking alone at night, or what happens if, I am the one who is at the wrong place at the wrong time? Also find that, for some of my other patients, say non-minorities, they sometimes find difficulty like making sense, because I think that, for a lot of minoritized individuals, they already know that these things are happening. But I think that for some of the non-minorities, it's kind of sort of like, how or whatever, why would something like this happen in America? But you know that this is the America for Black folks.
I think that's really interesting. Could you elaborate just a little bit about that? Because I always found that a very interesting dynamic for those that are non-minorities or non-people of color. I will have folks in my, if I'm working with them in a psychotherapy session, and when events like this, they're bewildered. It's kind of, the America that they think is there, they are shocked that this is actually what's going on. I don't know if you want to elaborate a little bit on that from your point of view also.
Yeah, I mean, I think that it's all about, experiences. So if you didn't necessarily grow up around a lot of minorities or anything to that effect, you don't necessarily have these conversations. Even if you are around minorities, I think sometimes I can even speak for myself. Sometimes I don't always want to discuss these things. You never know what you're going to get. You might find an ally, or you might find somebody who isn't as supportive. So, I think that the surprise, or the states of surprise, is just from lack of exposure. And if you don't have to live through racism, you can most certainly have blinders on and not notice.
Can you comment a little bit about the, from what you're seeing, Dr. Newsome, the fear that you're seeing in some folks, even if it gets to the point, which with some folks, it's going to get to the point of reactivating it's PTSD, if you will, but just comment a little bit on that.
Yeah, I mean, it's just a fear that, specifically with regard to, I've noticed it more with my Black individuals, fear that they might be the one who might die, or specifically with some Black mothers, what about my child? Is this what they are going to have to live with for the rest of their life? Or even my older individuals, this, they would suggest that, we fought already, and it's still going on. What is the fruits of the labor that we put in?
I would agree with you completely. What is the fruits? And you're going to see that particularly, you're going to see, in my mind, after having practiced for so long, you're going to see those strong reactions. You're going to see fear. You're going to see anger. You're also going to see, because I was talking with folks, you're also going to see, depending on who you're talking, you're going to see guilt that they could not stop this. I'm speaking in this particular case, some of my patients that are non-minority, it goes along with kind of that confusion, but sometimes I find that confusion with the guilt, what can I do? In this need to do something, in this desperate need to do something. But here's the problem. You don't really know what to do because no one is educated on it. And as you said before, depending on where you're at, actually doesn't really matter where you're at. Race is a very polarizing subject. No one actually even likes to talk about racism because it's so, oh my goodness. I mean, we've run away from it so much to the fact that we can't deal with it. I mean, so our patients, regardless of and this is an important thing, I think, now as I'm putting it out there, this is an important thing. Racism, whether or not you witness it, whether or not you utilize it, whether or not you are the subject of it, affects and hurts us all. And once we all have to start to own that. You can't just stay siloed, because eventually it's going to come back and affect you. And even if you're, as myself, I'll call myself out at this point in time. I mean, I could easily be Mr. Floyd, but at the same time, I am, due to my station or things of that nature, I have a certain level of privilege and autonomy. So, because there can be a tendency to put your head under the sand, look at how far we've come, Barack Obama, and you got to just actually say, no, we still have enormous amounts of work to do. So we've been talking about the patients. What have you noticed in regards to maybe your colleagues, how they've been feeling about this?
Well, I mean, I think that once again, there's that kind of sort of just feeling saddened by the events. But then I also think one of the things that I've noticed is that, some people are in environments where they have, program directors and chairs who will directly condemn and say, this is racist, this shouldn't happen, or anything to that effect. And then there's some programs that have been a little bit more silent. I mean, I've had people say that this is the first time that they have felt, isolated in a while because of that silence. And I think that it's also interesting. Some of the other things I've been hearing is based upon, we all have these physician WhatsApp group, and based upon these comments that people have seen, sometimes people are realizing that, these folks that they were just on the lines with fighting COVID are perhaps not the allies that they originally thought based upon the things that they are saying.
Wow, it's good that we're dealing with this from two different generations. You got the WhatsApp app in your group and the Google Hangouts and all that kind of good stuff. And you got me, still like, growing up with pagers and stuff like that. So, but it's interesting that what you brought up about folks that you fought or may have felt were your allies. And then because again, you're bringing up difficult conversations. You're bringing up stuff that we don't normally talk about. One thing that I have noticed is that some people around me, they've been silent because they don't know what to say. They're so concerned that like, I'm going to be offended or I'm going to hurt you or I'm going to say the wrong thing that they stay quiet, which as I reflect now is the wrong thing to do. Like, own your concern. I mean, I can't tell you how many times I've been in now two big meetings. Okay. And I've had multiple people that I consider friends say, I wanted to email or text you right then in the meeting and ask you how you were doing, but I didn't because I didn't know what to say. I was concerned. I was to the point to where I have like entered into meetings recently and I was like, and the meeting was tense and I'm like, what's going on? And now I realize they did not know what to say or how to approach it. And I think that is for me, that's been a very interesting dynamic. And it tells us, where we're at. And today, for instance, I was so pleased that I had the support of my dean's group when I was talking, but I felt I had to speak out. And again, I'm glad this is an after hours podcast, but I just had to straight out tell them. I mean, you want to know what I'm feeling? I'm feeling rage. I'm feeling rage. And you all have to understand that because I have to speak for those who aren't necessarily going to be able to express themselves. But more importantly, I have to speak for myself. I'm feeling rage. But again, how our colleagues are processing this and how they're thinking about this, I think runs the gambit. But I think for me, I think about people not necessarily knowing what to say or how to approach it. And then the other thing I was going to get back to, I absolutely agree with the leadership. You're going to get many different responses. And that is, I do have to watch what I say. I feel so I'm definitely supported at my institution. But with that being said, you laid it out. What else are you seeing out there in terms of your colleagues or how people are thinking about it?
Well, once again, it's also just spurring some folks to activism. So some folks have been participating in protests. I think there are going to be some white culture, Black Lives protests, among other things. So it's also spurred folks to action. And then it's also spurred folks to try to be more in a community, right? So of course, with the whole COVID crisis, we can't necessarily come together. So we've been doing like Zooms more so than anything else. But it's encouraged folks to want to do that more too, because, they want to check in upon their brother or their sister and make sure that they are doing well. And then also be able to express what's going on with them in a community where they know that they can get validation.
All right, Dr. Newsome, I'm gonna push you a little bit because I think I detect a little bit in your tone or your voice similar to kind of what I'm thinking or feeling. Yes, because I just got the email. Literally, as I'm talking right now, I just got the email, the white coats for Black Lives, the this, the that, and I'm going to do that, and that's going to be that. But I think your tone is similar to mine. Like, I've done this before. I've done white coats for Black Lives. Some of y'all may have protested. The question I'm asking myself, particularly after this display in what's going to be your home, DC, of the use of military and law enforcement to clear a public square of peaceful protesters. Yeah, I need to lay that out for folks. That is above and beyond the pale of anything that I've ever seen in my life. And we have to label that for the danger that it is, for the threat to the, if you will, everything that this country and the people that bled for this country stand for. So while I'm going to participate in White Coats for Black Lives and many other things, I am looking for what is actually going to move the needle. I am looking for, I think that protests are great, but at this point in time, I want institutions. I want money. I want lawyers. I want I want a very systematic approach that is a cold rage that does not leave. But please go ahead. Tell me what you're thinking about that.
No, I mean, I most certainly agree. We really need to be thinking about, of course, I think that the protests are really, really important, but I think that depending on where you are, you have different lens. So as physicians, especially as Black physicians, since there's so few of us, we really have a unique opportunity to, leverage that, whether that's, communicating that through op-eds, whether that's actually just calling up your senator or anyone like that and talking with them to try to move things forward. One of the other things that I've noticed is that, physicians are mobilizing. Just on, I think, Saturday, there was a physician, I forget the name of the physician, but she created a Zoom, and there were hundreds of physicians online trying to figure out, how can we structurally fix this? So I most certainly think that in this fight for, addressing racism, we as physicians most certainly need to lend our voice, lend our privilege to move the needle as best we can.
Okay. Well, now, Dr. Newsome, all right, I agree with everything that you said. Let's talk a little bit here about what some of our colleagues in the Black Psychiatrists of America, they put out, if you will, a public release. And I think this is a useful thing to go over and talk about for the MD Edge community. And you just tell me, we're just talking. You tell me just kind of how you feel about it. Here's some actions that they think should be taken immediately. All right. First one, declare racism a public health problem and establish national goals for addressing this as a health equity issue. Give priority to addressing the issues of healthcare disparities, including the mental health needs of historically marginalized communities across the U.S. What do you think about that?
I mean, I think those are two really, really important steps. The question is how do you make that happen, I think.
Yeah, Dr. Newsome, I'm liking you already. Exactly. I'm feeling like you're reading my mind. Keep going with it. I agree completely. I love that our colleagues put that out there, but that was my next question. Go ahead. Keep going with it.
Yeah, and I'm hoping, I know that there's going to be a town hall, I believe, tonight, and I'm hoping that, we can really be planning out how do we envision this? Because I can imagine that 20, 30 years ago there was also a dream that there would be a better society and there wouldn't be a bunch of police brutality, and I can imagine that there were similar ideals and hopes. But I think that we need to, put all of our minds together and say, how are we going to do this? Is this going to be something that we're going to put our money into? Is this going to be something that we're going to get senators and legislatures on board with and try to do policy, or whatever it's going to take?
Yeah. Let me read off some of the other points that they put out here. There are a few of them. All right, here, I'm going to go to the next one. Establish a government multidisciplinary and ethically diverse commission with representatives from the major healthcare professional associations in medicine, nursing, psychiatry, public health, psychology, social work, etc., in the faith-based community to provide recommendations to Congress regarding policies on how to best improve the health and well-being of our nation's Black citizens. I'll actually start on this one. I think that our colleagues came up with that's a very solid overall recommendation. My question, though, because we're MD Edge and we push, doesn't that in some way, shape, or form already exist? Could we not put up some type of, if you will, policy statements from all of these folks in regards to racism and things of that nature? Don't get me. So I agree with what they're saying, but maybe going off a little bit about what you're getting at, and this is why we do the dialogue. Part of me is kind of why isn't certain things in the current system working? That becomes a question to me. Are we not integrated enough? Do we not have enough crosstalk? Do we not have enough money behind it? So I agree with that, but I would be curious if that, I'd be concerned if that doesn't in some way, shape, or form actually already exist. But what are your thoughts about that, Dr. Newsome?
Yeah, I agree. I'd imagine with the National Institute of Minority Mental Health, they would have something similar. But I mean, I think that one of the things that you mentioned is really important. We need to look at, in addition to making these recommendations, we need to be looking at, where are these leaks occurring? Like, what is the current structure, and why is it the way it is with regard to the governance?
Now I'm going to read off another one. Declare civic mental health a national priority and incorporate it into the educational curriculum from K through college, as well as in the training of local, state, and national officials, law enforcement, and the criminal justice system. Now, this one, let me be clear. I like every single one of these. All right. Some of them and I encourage everyone in the audience, maybe we'll give a link to this press release, because now it's time for dialogue and discussion and hard conversations. If I'm reading off these points, some of them you may agree with, some of them you may not. But if there's one you agree with that you really are motivated for, that's one that you need to explore and dig in a bit more. All right. Because it's just too big for us to handle, just like racism, equality. That's a big thing to look at. You got to chop off pieces of it. And I'm going to tell you, I like this. I do like this. It obviously, these are broad points, but I do like how you can look at training law enforcement officers. A psychiatrist who was at GW, he's a member of GAP. I want to say he edited the APA handbook for prevention, and also it's Dr. Michael Compton. And he's done a lot of really good stuff. But importantly, he worked with police officers in terms of their interaction with those with mental health conditions, in terms of how do we work in terms of modulating our emotional response. Now, these type of recommendations in terms of particularly targeting law enforcement officers, for lack of a better word, that EQ, all of those type of things, I think is that I get very interested in seeing how far spread that is in the country. What do you think, Dr. Newsome?
Yeah, I mean, I think that, educating them on how to interact would be really, really important. I will say that I think that the National Alliance on Mental Illness does some of that work with regard to partnering with law agencies and trying to, talk to them about mental health and what cues to look at. And then I will say that there are some programs where people do ride-alongs with mental health clinicians there and police officers, which I find to be really helpful. But I mean, I think that, clearly what's going on right now isn't working. So any idea, I think I would be open to, especially if it seems reasonable.
Okay. And this is going to be my final one, because this gets at probably the one that I'm actually going to work with others to kind of take on. All right. Establish police community review boards with power to take action in areas of police misconduct, pending formal review by the appropriate authorities. This will offer a level of empowerment when communities feel they have a voice that can be heard. All right. This is kind of where my focus is going to start to be at as I move forward to try to do something sustainable. It has to deal with police brutality and abuse of power. All right. As it relates in general, but specifically to African-American men in lethal use of force. We need to work in which African-American men can make it to court. I don't know which other type of way to say it. Where African-American men, where every encounter with a police officer is not literally viewed as a potential lethal encounter. And a lot of people aren't going to like for me to say that, but it's the absolute truth. You have to think like that as an African-American male, regardless of your station or regardless of where you're at. But this is the reality of a thing. It's not saying that there aren't. There are many, many good police officers out there. I have many good, not many, but I have a few friends that are officers. I work with security in GW Hospital constantly. But the fact that still does not change the fact that if I get pulled over at a traffic stop, I know precisely certain things I need to do and not do, or else it could end badly. By that, I mean loss of life. So I encourage anything where we can start to take a systematic look at law enforcement and empower communities to look at, who's doing it right and who's doing it wrong? Because inevitably, when you look at these events, particularly, I'm not going to use this person's name who murdered Mr. Floyd, but if you're reading things or hearing things, there are things coming out that, which it always is, this is not the first time. This is not, there were red flags, there were things. So we have to start to look at this. We have to do the equivalent of, if you will, we have to learn from every single one of these situations and grow, because another one is going to happen next week. It's just whether or not you heard about it. That's the reality of what this state is in America. And that you may not like to hear, but that's just a fact. That's just a fact. So I really, that idea of, for me, targeting police as a starting point, and that abuse of power, and how we can actually have communities have a bit more of a, not a bit more, a whole hell of a lot more of a say so, is huge to me. What do you think, Dr. Newsome?
Yeah, I mean, I think that there are already like community partnerships, but I think that the idea of them actually being able to, like, for instance, bring somebody to justice, I think that would be really, really exceptional. And I think that one of the things I do think about, though, is like, we probably have to look at it from maybe even a I don't know, like a citywide or like statewide level, because I think that, depending upon the community, you just never know. It's difficult to like enforce. Like, for instance, like when I was in Alabama, there most certainly was a community, a collaborative approach for the police officers and the community of Birdsville. But on the same token, I don't know that, and I'm sure that they felt comfortable, or some of them would mention things, but I don't know that they felt like anything would happen anyway. So I think that one, it would probably have to be something where there was like some sort of deep investment from the state. And then I also feel like we'd have to work to make sure that people believe that that system would actually work in their favor, and not necessarily lead to more people harassing them for reporting or bringing something up.
Okay. I really like that. I like what you just said right now. Young generation speaking, deep investment, follow the money, as well as, if you will, people have to believe and trust that it's going to work in their favor. Because again, things can always go wrong. Now, Dr. Newsome, just listening to you, because you brought this up before, but I can almost feel like you were, because you grew up in the South. And you've been in Boston. I mean, do you have, because it's interesting how you said like enforcement from different levels. Has your going from the South to the East informed kind of how you view these issues, or how you think about them?
I mean, I will say that coming from the South, that I think things were a little bit different there, at least. And keep in mind, this is just me talking about me. I think that in the South, I mean, there were some acute racist things that you see, like direct racism. And you know who the racist people are, and you just don't go around them. I think that in the Northeast, it's a little bit different, because I guess I would say I've experienced more of the microaggression type things. So the more like things that you question, is this really racism? Is it not, among other things? So I actually do, even though I don't necessarily like the events that have occurred, I most certainly appreciate that understanding of being able to see, the Deep South, and then also see, even from the educated group, that experience in the New England area.
Yeah, I think I don't know if I've even mentioned this in the podcast. I mean, just speaking with Dr. Newsome, all of my family's from Alabama. Oh. Montgomery, Alabama, Birmingham, Alabama, Selma, Alabama. And I used to spend my summers. I'm originally from Cleveland, Ohio. I spent all of my summers in Alabama. All right. From, I want to say, kindergarten until, I don't know, until I went to college. So essentially, I'd always spend 1 to 3 months in Alabama. So I appreciate what you're saying, because particularly as it relates to the experience of racism in different parts of the country. And some people may agree or disagree with us, but I absolutely would say that. I mean, in Alabama, it was certainly, in my mind, definitely more overt. But in a certain way, people were okay with that, because it was just understood, and people lived with it. Whereas when you went to the Midwest and the North, things, it's a little bit different. As you said, I like the term that you use in terms of microaggressions, a little bit subtle. But here's the point. It still exists.
Yep.
And you have to, once you know how to navigate it, and once you understand what it looks like, you still realize no matter where you're at in the country, you're still going to, particularly as a minority, but certainly as a African-American male, you are going to have to deal with, and you're going to have to navigate this. Now we've been talking about just a lot of stuff. But is there anything like what else is on your mind? Just like anything that's coming to your mind, Dr. Newsome, as we've been talking, or?
I mean, I would say nothing in particular is coming to my mind right now. I think that, aside from the fact that I just know that we as physicians just need to stand up, use our privilege to support and push the agenda forward to ending racism in the United States. And that's the thing that has this conversation has led me to be thinking about in my conversations with everyone this week.
Hey, Dr. Newsome, if you don't mind, I'll jump in. And I know this is an interesting question, but I think that it's something that we just factually I'd like to know. Will you just explain exactly what an ally is? Because I know that term exists and it's in the nomenclature. But if you wanted to Google it, I think that you'd find advertisements for a bank and, a dictionary definition. So you could just talk about what that means in regards to this conversation and LGBTQ rights and gender rights, and what is an ally and how is one an ally?
Yeah, I mean, I think of an ally as someone who stands with marginalized communities. Like even when the going gets tough, I feel like, for instance, when nothing's happening, it's easy to say, I support Black folks, I support Hispanics or LGBTs. But, when the going gets tough, when people are out there protesting, when your own colleagues are perhaps saying things that might be a microaggression or something that might be subtly racist, I look at it as an ally or an upstander, someone who is going to be able to not only support you in a hidden way, like that must have been really difficult or something like that, but also actively speak against those negative things that have gone on. But I'd like to hear Dr. Norris's opinion upon it.
Dr. Newsome, I think you actually, I think you described it very well. I mean, in regards to there's many different definitions of it, or you can do it a lot of different ways. But I think the key word that you said was stand. I think some that stand. And if you look at in this country, movement has been made when you have allies of different related but different viewpoints at times too. But we can all agree upon certain common goals that we will stand with each other and accomplish. So I agree with that completely. And, Dr. Newsome, I'm going to let Nick jump in here, but just listening to you, because I'm glad Nick asked a question because it gave me a chance to just sit back and look. Now, I don't know where I'm going, but what do you think? Is there any way that social media can transform how we're going to be doing this differently compared to, because one of the things that they said about the civil rights movement was it was the cameras and the TVs and the pushing this out. Do you see any way that social media might affect the way in which we think about, it already does, but think about racism, process it, network, come together? I know I'm putting you on the spot with this, but you're the next generation. So,
Absolutely. I mean, most certainly social media has expanded. I remember when I grew up and I was just starting on Facebook, right? But it wasn't the phenomenon that it is now. And just with the push of a button, people can post something on Twitter, say something negative or make a comment. So I think most certainly social media adds to, people's concerns with racism. Because I mean, even if there's plenty of folks I've had to just subtly block on Facebook based on some of the things that they post, or at least hide their viewpoints. So that being said, so it can be used as a negative. But on that same token, I do think that we can start using social media in a positive way with regard to actually getting folks like yourself or like me or other champions in the community to really have those tough conversations and get people that access that they might not otherwise have. Because one of the things that we mentioned before is that everybody doesn't get a chance to have conversations about racism or get that. So we can talk about it.
Right. Let me just jump on that for a minute. Let me ask you, because I'm curious. In your group, in your kind of your age cohort, how many conversations about race are y'all having?
Yeah, I mean, right now it's a lot.
Well, that's good. That's good. I mean, you'd be surprised in my age cohort how little is actually happening. That's why I asked the question. I was very curious about that. And for the audience, I'm 47, so there you have it.
You don't look a day over 29.
Oh, thank you, Nick.
You're welcome.
So most certainly right now a lot, but then I also want to give the context that, I'm at Boston Medical Center where a majority of our patient population are Black and Hispanic, and we have this mission to give exceptional care without exception. So I do think that in some ways there are going to be perhaps more conversations about race and social determinants of health here at Boston Medical Center than perhaps other places that don't necessarily have the same population.
Okay. What else was on my mind here? Dr. Newsome, if you had a wish list, maybe of 2 or 3 things that you could, a wish list of 2 or 3 things that you could see happen right now that would, let's say, I'm not going to talk. We'll focus on. We're going to go back to our patients because that's where our strength and our power comes from. Because they honor us by letting us serve them. If you had to put a wish list of 3 things for our patients and what they are going through right now, what would it be? What would be your wish list, man?
A wish list for
our patients, not for us, not specifically for racism per se, but for our patients. And we're going to bring it back because I want to bring it back to the patients. What would you wish?
I mean, I think for my patients in particular, one thing I would wish for them in this time of crisis is for, whatever, I know some of them are able to work, some of them aren't, but for whatever entity that if they are working for whatever workplace that they're at, to specifically condemn racism and try to make sure that they don't feel isolated. So that would be one thing. I mean, I think that I don't want to necessarily go into the political realm, but I wish there was a united national front for my patients to once again condemn racism and then also just talk about police brutality and not do anything that might be triggering to marginalized communities. And I would say that those are the top 2 things that I wish would happen.
Okay. I think that those are just actually being at, if I want to make sure I got your first one, if they're at a job that acknowledges and sincerely condemns racism through actions, words, and deeds, I think that in and of itself, because people have amazing resilience particularly if they feel so that they're heard and they feel so they're supported. And when you spoke, Dr. Newsome, that was the thing, with that that you were wishing for, that I absolutely completely agree with. And if I had to wish for one thing, let me get my mind right. I wish that all the clinicians across America, particularly in EDs, or on the front lines everywhere, but definitely EDs. I know you're tired. I know you are stressed. I know you're exhausted. I know many of you are risking your life. I wish for my patients that you continue to collaborate with them and you take that extra 10 seconds or that extra minute that's going to make a difference in making the correct diagnosis and getting that, if you will, that housing right or getting that follow-up right. And that's just not for African Americans, that's for everybody. I wish that you remember a lot of the things that we talk about in terms of our oath and that you dig deep one last time and you slow down and you listen and you ask yourself, okay, what can I do? What can I do? So yeah, I wish that, because right now we are all hurting. We are all hurting. And we need to collaborate with our patients, and we need to do it in a very mindful way in which we are slowing down and we are not reacting and we are not being emotional, and we are still continue to work and collaborate with our patients and serve. So yeah, if I had to wish for anything, I would wish that our patients still get the amount of time and a bit more in regards to when they come to the ED or the clinic, because Lord knows they're already going through enough and all of us are in masks. So let's give them a little bit more time if they can't see our face.
I think that would be absolutely wonderful.
All right. Well, look, Dr. Newsome, what can I say? When you come here, gonna hang out. I'm gonna take you around, gonna talk basketball, whatever, something like that. We'll get Nick on the line. We'll finish because he still hasn't finished watching all that Jordan documentary.
This is a Michael Jordan podcast, by the way. This is not a LeBron podcast. This is a Michael Jordan podcast.
Michael Jordan podcast.
That's
Actually,
right.
You know what, Dr. Newsome, what I'm going to do is, you don't know this, but see, we got a fantasy basketball league as well as football league at GW or whatnot. So you're going to be a fellow. So I need to recruit you into that. And before COVID, I was winning. So I hope my residents are listening to this because I was absolutely winning. And I was going to win first place, and I still might. So, but Dr. Newsome, I am looking forward to seeing you at Children's, seeing you as part of the GW family. And look, just keep doing what you're doing. And even though I just met you, all I can say is that I'm very proud of you and how you represent yourself, how you represent all of your patients, and regardless of their color. And it was just a privilege talking with you. Okay.
Absolute pleasure to speak with both you. And thank you so much, Nick.
And that concludes this episode of the Psychcast. This emergency episode was published episode number 120. If you have any comments or ideas for the show, you can email us at podcast@mdedge.com. You can also contact us via Twitter at mdedgepsych. For Dr. Lorenzo Norris and Dr. Brandon Newsome, I am Nick Andrews. You're listening to the Psychcast.